My name is Retno Dewi, Putri. I'm a part-time English teacher at International University Symposium of the Faculty of Humanities, University of Indonesia. Now, I would like to present my paper on language planning and language policy, the process of terminology formation on the Indonesian COVID-19 Response Acceleration Task Force. Since the World Health Organization declared that coronavirus disease 2019 or COVID-19 is a global pandemic, the government of Indonesia formed Gugus Tugas Percepatan Penanganan COVID-19 or COVID-19 Response Acceleration Task Force or COVID-19 Task Force. This task force's main jobs are to improve the awareness of escalation of COVID-19 dissemination, to improve decision-making, and to improve the readiness and capabilities of preventing, detecting, and responding to COVID-19. And according to the decree of the Minister of Health, one of the strategies in doing their job, the COVID-19 task force needs to improve the risk communication and community of empowerment method. This should be maintained by good public communication to avoid misunderstanding among the society. Especially in this pandemic situation, mistakes in decision-making should be reduced so every Indonesian citizen can survive.
Unfortunately, the government, which is represented by the COVID-19 task force, is considered as giving ineffective terminologies during the pandemic. Here are 7 photos of banners which show the society's misunderstanding on the terminologies used by the government. Here are the first 2 that should show lockdown, but because the society has no capability of mentioning and spelling the word lockdown, this is what happened. And there's also misunderstanding. Lockdown becomes London. And on the next banner, it has London and Argentina. Argentina means quarantine, or in Bahasa Indonesia, karantina. And this is how lockdown becomes also how lockdown becomes download. Very different words and meaning of the terminology lockdown that is referred to what the government means. Besides these banners, this research data is also collected by an online questionnaire. There were 109 people who responded to the online questionnaire in 1 week time. And from their background, we can see that most of the respondent is in 21 to 34-year-old category. And most of them graduated from university. Most of them have bachelor degree. And most of the respondents work in a private sector. From all of the terminology used by the government, 100% of the respondents admit that they understand what is lockdown and social distancing. On the other side, discarded became the least well-known terminology from the government. And from the source that they got the terminologies from are the social network media, and the least is from their neighbor. Now for the terminologies between March and June 2020. Here are them. Being responded by 75 until 101 respondents. Unfortunately, less than 50% of the respondents answered each of the terminology definition can divine what the terminology is. Same things happen for the terminologies introduced in July 2020 by the government. It has less respondents comparing to the previous terminologies, and still less than 50% of the respondents in each terminology has the capability to divine each terminologies correctly. The last section of the questionnaire contains 1 question about the definition of new normal and the description of health protocol in new normal phase. There were 94 respondents who answered the first question by defining or translating the terminology of new normal, while the second question, responded by 100 people, was answered thoroughly by 83 respondents. This actually represents an in-depth understanding of the health protocol by the society during the new normal phase. However, the representative of the government still blame the misunderstanding happens among the society for the increased number of COVID-19 cases in Indonesia. Unfortunately, this is not true because there are actually some inconsistencies in the government themselves when they're publishing documents or press conferences videos. Here are some examples to show you how the government is also being inconsistent in publishing their documents and also press conference videos. In these two documents, we can see the underlined word is tatanan normal baru and kebiasaan baru. This is the example how two different division in the government translates new normal into their documents. This inconsistency can actually cause confusion among the society. Another example is in this document. When it comes to social distancing, the document from the Ministry of Health and also the Ministry of Transportation, one says menjaga jarak minimal 1 meter and the other one says penerapan jaga jarak fisik and added physical distancing in it. So this is another example of how the miscommunication or the inconsistency between the division in governments can lead to confusion among the society. So we cannot blame the society only for this. The inconsistency of the government is not only in translation and interpretation of terminologies in English, but also in basic rules of language and linguistic. As we can see here in number 8A, B, C, and E, these sentences have no period at the end of it, which is not a good English sentence or basically almost any language sentence. It's very different with number 9. Number 9 point A and B, they do have a period at the end of the sentence. Besides the documentation, the government also shows their inconsistency when they're doing press conference. In some of the video, Yurianto, as the spokesperson of COVID-19 task force, shows his difficulties in mentioning some terminologies in English, such as social distancing. Also, he sometimes came up with some new terminologies that is not in the list of terminologies that being published to the public and to the media. So, this means that the rising number of COVID-19 cases in Indonesia cannot be blamed only to the misunderstanding happened in the society. The government play a big role here by being inconsistent in delivering and using the terminologies that they made by themselves.
As we can see, the lack of language planning in the communication process between the government and the society during the pandemic has caused a confusion among the public. It is necessary for the COVID-19 Response Acceleration Task Force to maintain language planning, which is in line with the country's values and norms represented in our language policy. As a conclusion, language planning is recommended in any decision-making by the government. This can be done by inviting language experts from Badan Pengembangan dan Pembinaan Bahasa or Language Development and Construction Agency, which is not available, unfortunately, in the COVID-19 Task Force team. Communication during the pandemic needs to be done fast. However, this does not mean country's language policy can be ignored. That is why language planning with the support of experts is needed, informing terminologies as one of the communication strategies. Therefore, we can avoid misunderstanding among the society during the pandemic, which can help controlling the number of COVID-19 cases in Indonesia. That's all from me. Thank you very much.